You know that the dose in the spot film, spot radiograph, is much, much, much higher than that last image hold. It's ridiculous. Now, if you say, well, why? It doesn't really matter that much. Well, it matters if you start to adopt this behavior for simple cases. Then when you're in that crazy complex case, it will be second nature, and you will be using last image hold, fluoro video clips, a low frame rate. It will become second nature. So this is a beautiful DSA of the IVC. The IVC is the inferior vena cava, the big pipe that brings blood back from your legs. These are the iliac veins. There's a little marker catheter here that we use. That's 2 centimeters between those two dots. We want to make sure that this cava is roughly 2 centimeters. So we'll measure that distance, then measure the cava. Because if it's too big, the filter won't stay put. The filter will take off and go to the heart and then the lungs. The patient could die. So we measure. So at the beginning, we really want to know where things are. We want to know how big the cava is. And we want to see this. This is inflow from the renal veins. The renal veins are bringing in blood that's unopacified. Now, if you just use a fluoro video clip, you probably wouldn't see that subtle finding. You need to know exactly where the renal veins are so that the filter is put just below the renal veins. What else is here? This is a feeding tube. That's not important. You see the colon is subtracted out, but this is a really nice picture. After I put the filter in and I want to confirm that the filter is staying put and the filter isn't tilted, if an IVC filter, which is roughly shaped like a cone, tilts, 2 things happen. The IVC filter doesn't work as well, so clots could get by it, and the tip of the cone, which often has a hook or some device on the top, a hook usually, sometimes just a little nubbin, the hook will embed in the cava wall and you won't be able to take it out. So if it's tilted, I probably will put it back in and see if I can get it straight. Do I need a big, huge, beautiful picture, a large dose to see that? No. So now I'm working from the groin, a sheath is here, you can just see the mark. I've injected contrast under fluoro. This was in an older room, so I couldn't save the whole video